Good afternoon, everyone, and welcome to the 2021 Murrumbidgee Local Health District Excellence Awards. These awards celebrate the achievement of our staff, those exceptional people who have created and continue to uphold our values of excellence, innovation and collaboration. My name is Millicent Brown and I will be your co-host for this afternoon with Mr. Michael Cummins from the Pegasus Health Group. To begin our formal proceedings, I would like to introduce a very special person to our district, Auntie Isabel Reid.
I'm Auntie Isabel, Wiradjuri Elder. I'm here to present the Welcome to Country, which is so very important and also very necessary, as it demonstrates an ancient tradition to welcome visitors to our ancestral lands, which has been conducted over thousands of years to officially welcome people and to identify who we are and who you are. I would now like to acknowledge and pay my respects to the custodians of this land, the Wiradjuri peoples, whose land you are gathered on today. I also wish to acknowledge our elders, past, present and future, for the whole memories, their tradition and culture of all Aboriginal Australians. So in recognition and respect for all Aboriginal people, our culture and heritage, it gives me so much pleasure to welcome you all here to the land of the Wiradjuri peoples. Thank you.
A big thank you to Auntie Isabel for opening today's award presentation. I would like to introduce Ms Jill Ludford, Murrumbidgee Local Health District Chief Executive, to provide a welcome today.
Thank you very much, Michael, and welcome everybody to the Murrumbidgee Local Health District Excellence Awards. Murrumbidgee Local Health District has over 3,800 staff, and you know what that means. There's 3,800 voices out there ready to cheer. So as you watch this, colleagues and staff, make sure you get your groups together and cheer out loudly for people who have nominated from your teams. Now, our district, as I said, has over 3,500 or 800 staff, and we are one of the biggest employers in the region. This event is a celebration of the difference that you, our healthcare workers and support workers and staff, make to the fabric of our communities. So our region and our organisation works to provide exceptional rural healthcare. Healthier together, we absolutely value the importance of our communities and our rurality. And we critically also value the input from consumers, care tailored to people's needs. We also prioritise working with all of our health partners in the primary health network, GPs and social care providers across our region. Today is a special day. It is a day dedicated to our staff and volunteers who work tirelessly to improve health outcomes for the people in our region. I am proud of you all. I'm proud of all of our staff, all of our volunteers, and I want to thank each and every one of you for the wonderful work that you do. Let's face it, the last 12 months have been really tough, really challenging, but all through this time, everyone in our communities and in our organisation have held you in enormously high regard. Staff recognition is not just about today. It should happen every day, and this is a special day to recognise the excellence and innovation that you have shown. Thank you to our healthcare workers who work shift work 24/7. Many of you over this time have changed your roles significantly to respond to the COVID pandemic. You've put your hands up to do different work. You've put your hands up to work extra hours. I cannot tell you how much that means to our organisation. And I haven't forgotten our support workers who work to make sure that our healthcare workers are supported in their hospitals and healthcare settings. Also, we have our managers. We can't forget you. You work tirelessly, lose sleep to keep everything going and pull all the ends together. I want to thank our volunteers and our community members who help support our patient outcomes and keep us honest. You make me feel so proud of your achievements. Your work makes our organisation strong. So today I have a few apologies. I have an apology from Ms Fran Trench, who is from the Riverina Training Hub, from Dr Joe McGurr, who is the member for Wagga Wagga, and Ms Steph Cook, who is the member for Cootamundra. I'd also like this opportunity to recognise our award sponsors. And we have Michael here with us today, who I thank greatly, from the Pegasus Health Group and Pegasus Hospital in the Home. University of New South Wales, Medax Healthcare, the Three Rivers Department of Rural Health, the Riverina Rural Training Hub, Agency of Clinical Innovation, our colleagues, the Murrumbidgee Primary Health Network, we thank, Aware Super, the Temora Shire Council, great friends of the Murrumbidgee Local Health District, and our event contributors, the Griffith City Council and Damas Apply Limited. Congratulations to all of our nominees. In my eyes, you are all winners. Your efforts and commitment have been recognised today, and we thank each and every one of you for the work that you do every day for the people of the Murrumbidgee Local Health District. So enjoy our Excellence Awards, get your best cheering voices on and enjoy. Thank you.
Thank you, Jill. We would like to begin the presentations by acknowledging all the nominators. Without your time and effort, we would not be here this afternoon. I would like to wish all the finalists today the best of luck.
We would like to take the opportunity to recognise our major sponsors, Lease Plus, Pegasus Health Group and Pegasus Hospital at Home, the University of New South Wales, Medax Healthcare, Three Rivers Department of Rural Health.
Our silver event and award sponsors, Lease Plus, Riverina Rural Training Hub, Agency for Clinical Innovation, Murrumbidgee Primary Health Network, Aware Super and Temora Shire Council.
And our event contributors, Griffith City Council and Damasa Proprietary Limited.
The first category today is the Aboriginal and Torres Strait Islander of the Year Award. This award is presented in recognition of outstanding achievement by an Indigenous staff member or team, and the winner will receive $1,500 towards their professional development. I would like to introduce Mr. Andrew Turner from Medax to announce the finalists and winner in this category.
Good afternoon, everyone. My name is Andrew Turner, and I'm Director of Specialist Staffing at Medax Healthcare, part of the Impelum Group. It gives me great pleasure on behalf of Medax Healthcare to announce the winner of the 2021 Aboriginal and Torres Strait Islander Leadership Award. Medax Healthcare is a leading healthcare staffing company providing healthcare recruitment expertise to both the public and private sectors, and we are proud to partner with Murrumbidgee Local Health District. The Aboriginal and Torres Strait Islander Leadership Award is presented in recognition of the outstanding achievement by an Indigenous staff member or team, and the winner will receive $1,500 towards their professional development. I'd like to congratulate all the finalists in this category today, which are Brungle Health Expo.
My name's Amy Byram and I'm the Targeted Early Intervention Coordinator for Murrumbidgee Local Health District. So we ran the Brungle Health Expo this year in March, and the day was to bring MLHD service providers together to work in partnership with the Brungle and Tumut community. The day was a success. We had over 100 stall providers come along and showcase what services they do for the community and how they can be contacted and what they can provide. We had really good uptake on community people coming along, and the day was just about coming together as a community, and it meant a lot to the whole of the MLHD. And being nominated for this award has been a real privilege and honour to be nominated for an Excellence Award, and the whole team, Aboriginal Health team, are just thrilled.
The Aboriginal Artwork Commissioning Project.
Hi, I'm Kelly Payton. I'm the Administration Officer for Aboriginal Health, Murrumbidgee Local Health District, and I'm here to talk about the award we've been nominated for. It's for our Artwork Commissioning Project. So the Murrumbidgee Local Health District didn't have any procedures in place to make a fair and equitable purchase of artwork for Aboriginal and Torres Strait Islander people. So Jackie Brodie, Belinda Whitney, the communications team, procedure, the procurement team, and I had a little bit of input as well, have put together a package on a process to purchase artwork, and this process allows for the artist to be recognised every time the artwork is used, and it's also a safe process for the artists. They get paid, and their artwork is used in an appropriate way, which is agreed upon by the MLHD and the artists themselves.
And the cultural awareness package.
Hi, I'm Kelly Payton. I'm the Administration Officer for Aboriginal Health Murrumbidgee Local Health District, and I'm here to say that we've been nominated for awards for our Aboriginal and Torres Strait Islander cultural package. And what this cultural package entails is some information for the whole staff of MLHD. It has lanyard cards, which has the appropriate and culturally safe acknowledgement to country terms on it. It has NAIDOC speaking notes. There's a cultural rounding tool that is significant for staff, Aboriginal and Torres Strait Islander staff, because it's culturally safe. And there's also a consideration fact sheet. And there's also a page that has significant events that happen throughout the year. So if you're wondering what's happening throughout the year, you can go onto the ALMOD page on my hub, and you'll be able to see the whole package there. Yeah, we're very excited to bring this to you.
And without further ado, I'm delighted to announce the winner is the Aboriginal Artwork Commissioning Project. Well done.
Well done, everyone. The artwork is exquisite, and I have been advised that there is a way that all of our staff can own a piece. Stay tuned, everyone. The next award is the Focus on Wellness Award. A big thank you to the Murrumbidgee Primary Health Network for their generous sponsorship of this award. The winner will receive $1,500 towards their professional development. Please join Julie Redway from Murrumbidgee Primary Health Network today to tell us a little more and announce the winner in this category.
The Focus on Wellness Award is presented in recognition of an individual or team who seizes every opportunity to work in partnership with consumers to build and maintain wellness. The winner of this award will receive $1,500 towards their professional development. The finalists are Oral Wellness Lifelong Collaborative Program.
Murrumbidgee Oral Health Service team are really honoured to have been nominated for an Excellence Award about a project that we're all passionate about. The project is called the OWL program, and the OWL stands for Oral Wellness Lifelong, and it's a collaboration between ourselves and the MLHD aged care teams and residents, residential aged care facilities around our district. So OWL revolves around two major components: the residents and the staff and their carers. And those residents of MLHD aged care facilities are eligible for an oral health assessment done by the oral health team in an outreach model. The program has been set up as a collaboration between aged care services and oral health services, and we've partnered around buying equipment and oral health services providing staff that visit rotation to the 17 facilities that we have in MLHD. And our leads on this are Jane, 26 facilities. Oh, it's 26, I got the numbers wrong. Sorry.
26 facilities all up.
Wagga Cluster sends out Wazia, who's with me here today, and Jane is our administration person that coordinates the visits with the facilities. So we go across this MLHD, we go out as far as Lake Kajelico, and we go down to the border, and we also go up as far as Young and Harden and those places as well. So it's a great way of providing access to oral health care and oral health assessment for residents in their place of residence. And that's such a key feature of this, and bringing families into the discussion about what's appropriate care and how we manage that care as a health service is part of that discussion. And it's been coming for a while. We started a little bit locally here within the hospital setting, and it all kicked off really with a resident from Gundagai many years ago who needed to be brought to Wagga Hospital by ambulance to have an assessment, and really no treatment was able to be done for that patient. So it was really quite a expensive and time-consuming effort for the aged care facility to bring the patient to Wagga, and so really flipping the model where the dental professional team goes to the aged care facility is a great result of having that problem arrive and then working on a better solution.
Tamika Cahill, Allied Health Assistant from Hillston.
Hi, I'm Tamika Cahill, the Rural Allied Health Assistant from Hillston MPS. Being nominated for the Focus on Wellness Awards means a lot to me because it's something I'm passionate about. Knowing that when I come to work, I'm making a difference in someone's life, that's what makes me smile at the end of the day. My day includes multiple duties, from booking appointments, home visits, home exercise programs, or even just a social check to our patients living in the community. I also work with our consumers living in residential aged care and also our inpatients in the hospital. Due to COVID and limited face-to-face services running, I'm here to assist our community in running telehealth or virtual care services so our community can still see the services that are needed. Our service is important to our community as it allows residents living in Hillston and surrounds to be able to access health services without having to travel too far. Griffith is 110 kilometres, which is our closest hospital site. However, in some circumstances, clients have to travel 3.5 hours to Wagga Wagga. We have numerous visiting services from podiatry, eye clinic, dental, women's health nurses, mental health, drug and alcohol, just to name a few, allowing locals to be screened and checked more easily. This saves Hillston patients a lot of time and money travelling further afield for these services.
And Women's Wellness Team from Young.
Hi, my name's Jackie Cooper. I'm the CME at Young District Hospital. I also work as a registered midwife and registered nurse here in our rural facility. I was just going to have a bit of a chat about our Women's Wellness Day, which we held a few months ago now. This initiative was highlighted when we began our Get Healthy in Pregnancy program. We highlighted that there was a lot of women out there that didn't have a lot of knowledge about the benefits of them being at their peak when they fall pregnant, even before they fall pregnant, actually, all the way through their pregnancy. What if they didn't follow certain guidelines and achieve things throughout their pregnancy in their wellness, what that would actually lead to. We put the feelers out, and which is quite normal in our facility. We have very, very supportive disciplinary team members. We had a very good reply. So what we aimed at addressing here was just a real community get together, talking about issues surrounding pregnancy, things that we thought our women needed to know, but just to bring everybody together so that we were able to make that initial contact and let them know what services we had around. So our team consisted of several midwives, our facility manager, who we couldn't have done this without. She was very, very supportive throughout the whole process. A representative from the Get Healthy in Pregnancy program. We had a generalist counsellor, which we felt was a real necessary addition to our team. Our dietitian, diabetes educator, mental health personnel, our women's wellness nurse, and one of our registered nurses who's a yoga instructor. So that was a very fun part of our day. We had a couple of meetings, worked out what we wanted to achieve, and it was really just the education and making ourselves known out in the community and letting the women know that it's a very approachable and open area of health. So we approached several businesses to see whether they would be able to offer any sort of support, whether it be in way of gifts or vouchers, those sorts of things that we could use for our women on the day. And we had a great response, we really did. We are a rural facility, as I've said before, and it's a real big community here. One of the things that we were really impressed by, we received some funding for our day, and that come from Hilltop Suicide Prevention Network. They actually covered all the costs for the day, which was wonderful. We were able to provide our women with a luncheon and refreshments and a lovely area to hold our day. There were gift bags we were able to give out and set up stalls and have even lots of NGOs join in on our day so that women had a real diverse area to look across for what that we have in the community. So it was very, very successful. You know, our numbers could have been a bit higher, but this is the first Education Wellness Day that we've held here from Young Health Service. So it was a very successful day. If we have, managed to just change a few people's insight and knowledge surrounding pregnancy, birth, and the very important aspects of, maintaining health and wellness during that time, we've hit our target. Following our feedback, the feedback was extremely good, and the community has come forward now and asked us to cover some other days and hold some other topics, which is really, really good. So thank you. We're very happy to have been nominated. It's lovely. It's a lovely reward for the whole team, to be able to see that all the effort that they put in, and as most events like this, it's all unpaid, it's all voluntary, and we just want to improve our community and our women's access to services. So it was a real good tick for all our participants. It was lovely.
Congratulations to all of our finalists. And the winner of the 2021 Focused on Wellness Award is Tamika Lee Cahill, Allied Health Assistant from Hillston. Tamika has been employed as an Allied Health Assistant with Hillston MPS for over 10 years. She draws on her wealth of knowledge and expertise to develop a wide variety of experiences for patients and residents in her care, with a consistent focus on improving client wellness. Tamika is always looking for ways to contribute to improving health services and the broader community in Hillston. She immerses herself in many community events and volunteers her time to organise and support a range of wellness programs. She gathers consumer feedback to continually improve the services she provides and consistently upskills to provide a broader range of services and activities to her clients. Tamika is currently studying as a dental hygienist to provide additional support to the visiting dentist. Congratulations, Tamika.
Congratulations, Tamika, for the great customer service you provide and on winning the award today. Collaboration is important for rural healthcare today and providing care tailored to people's needs. Timely, the next award today is the Collaboration Award. I'd like to call on our award sponsor from Riverina Rural Training Hub, University of Notre Dame, Fran Trench, to present this award.
Hello everybody, my name's Fran Trench and I'm the Executive Officer of the Riverina Regional Training Hub, part of the University of Notre Dame's Rural Clinical School. It gives me great pleasure on behalf of our training hub to announce the winner of the 2021 Collaboration Awards, part of the Murrumbidgee Local Health District's Excellence Awards. The Regional Training Hub program is a Commonwealth-funded program developed to expand pathways for rural study, rural training and rural medical careers. The University of Notre Dame, Australia established the Riverina Regional Training Hub in July 2017. We now have a presence in both Wagga Wagga and Griffith, but provide collaborative support across the health district for medical students, junior doctors, their supervisors, mentors and teachers to improve rural health outcomes across our region. The Collaboration Award is presented in recognition of partnerships that achieve mutual success as a result of collaboration. Hardly surprising. The winning team will receive $1,500 towards their professional development. I'd like to congratulate all the entrants on their work. Under what have been trying circumstances, they've put together their submissions, but they also continued to do the work they were across the region. I'd especially like to congratulate the finalists in this category. Alcohol and Drug Telehealth Service Pilot, the Hillston Multipurpose Service, the Virtual Social Work Service based in Wagga Wagga, another pilot. Before I announce the winner, let's hear a little bit about the finalists. For me, it is interesting that 2 of the finalists have successfully based their projects around virtual or digital solutions to providing better rural health service for us all. All the projects responded to the changed environment created by the current pandemic. The Alcohol Drug Telehealth Service is a joint initiative between the Murrumbidgee Local Health District and St Vincent's Hospital in Sydney.
Hi, my name's Penny Hall. I'm the actual OTP District Clinical Leader for the Drug and Alcohol Service at Murrumbidgee Local Health. So my role encompasses supporting staff and prescribers across Murrumbidgee District around opioid treatment program. So working collaborative with St Vincent's Hospital, we've been able to develop a fabulous program around supporting our consumers and also our staff in drug and alcohol. It also provides an insight for St Vincent to see the distances and the complexities that we have to deal with in this service. So this project is really important to me and the service around it. It's giving us more access and our consumers more access to addiction specialists and in a better turnaround. So historically we have only had access every 3 months with our clinical director. Now we have twice weekly access to addiction specialists from St Vincent's who provide us with support, provide our consumers with support and some direction around our case management. It's really been fabulous to be nominated for the Collaboration Award. It also shows us how we can work together as a service with our other services from major metropolitan hospitals. So being nominated for the Collaborative Award is just really important for the service. It's showing how we can work together with another metropolitan service. It's also has actually brought our drug and alcohol OTP teams closer together. We're able to have more communication. We're learning together. We're also, being able to provide our consumers with the best care that we possibly can, considering in the current times that we're working in.
Our next finalist is the Hillston Multipurpose Service for their Work, Health and Safety Whole Staff Training Day.
Hi, I'm Courtney and this is Bessie and I'm the manager of Hillston Hospital.
Hello, my name is Blaine Horn. I'm the C&E in Hillston Hospital.
I'm Jody, maintenance supervisor at Hillston Hospital.
I'm Laura, physiotherapist here at Hillston MPS, and I'm also the moving and handling champion.
My name's Julie Allen. I work for HealthShare New South Wales. I'm the site supervisor for food and patient support services here at Hillston MPS.
In April we held a whole staff Work Health and Safety Day. We had 100% compliance. It was a fantastic day, followed by a really nice staff lunch with the residents, and it was fabulous.
Also, I'm the fire safety officer. We had a big training day. All the staff turned up. We got 100% compliance, which was really good.
Training day in April was a great team bonding activity and great to get to know new members of staff.
During April, we collaborated together as a team and developed a training day in which we tried to target multiple aspects of our midwifery training. We managed to get through our basic life support, fire evacuation. We went through how to do things on AFN and MyHub, how to check the car for maintenance. We also went through hazardous manual tasks, as well as multiple other aspects of our midwifery training. We did manage to achieve 100% compliance by the end of that April, and we are very, very proud of ourselves.
I am so excited we have been nominated for the Collaboration Award. We all work well together here. We're a team, a whole team.
I'm so excited we've been nominated for a Collaboration Award, as Hillston MPS is an amazing site where everyone always works well together.
I'm so thankful that we have been nominated for this fantastic award. It's just great.
And our last finalist in this category is the Virtual Social Work Service, which was piloted in Wagga Wagga.
So my name's Sam Lloyd. I'm the Telehealth social worker with the social work department at Wagga Base Hospital. I cover the local health district in a virtual capacity, covering the outlying sites around Wagga Base Hospital and Griffith Base Hospital. I have been nominated for the Collaboration Award with the Excellence Awards, which is fantastic for this role and the social work department. I think that collaboration is a huge part of what social work offers, and it's testament to how this position has flourished in the last 12 months, working collaboratively with the multidisciplinary teams in all these little regional sites and bringing together all our specialties to get best patient outcomes. It's been fantastic, so very excited to be nominated in this category.
And the winner of the 2021 Collaboration Award is the Alcohol, Drug and Telehealth Service. Congratulations to that team.
Thank you, Fran, and congratulations to the Alcohol and Drug Telehealth Service. Michael, telehealth is becoming such a big part of our lives, providing more and more access to the community and allowing our consumers to embrace new technology.
Telehealth is a great way to connect. It's accessible and easy to access and use. Looking forward to seeing how it integrates in the future.
Watch this space, Michael. Now, Christine Howard, Director of the Three Rivers Department of Rural Health, will be joining us to present the Excellence and Innovation Award today. The winner will receive $1,500 towards their professional development, and the award is sponsored by the Three Rivers Department of Rural Health. Over to you, Christine.
Good evening, my name is Chris Howard and I'm the Director at Three Rivers University Department of Rural Health based at Charles Sturt University. Our department is funded by the Commonwealth Department of Health to support the recruitment and retention of rural health professionals. I'm really sorry that I couldn't be there in person tonight to celebrate your amazing work, but it does give me great pleasure on behalf of Three Rivers to announce the winner of the Excellence and Innovation Award. This award is presented to an individual or a team in recognition of their pursuit of excellence and innovation in any field, and the winner will receive $1,500. The finalists are On Track for Life.
Hi, I'm Jackie Priestley and I'm representing the On Track for Life team, which includes Dr. Megan Southern, Cherie Morris and Olivia Kelly, dietitians, Harris Omar, our evaluation officer. We've also had wonderful support from our governance group, Dr. John Preddy, Nicole Myers and Jodie Bruce from Child and Family, Sabrina Brown from Aboriginal Health and Sandra Ford from Nursing and Midwifery. So together our team developed the On Track for Life project, which had a number of different outcomes. We trained 219 staff, so 200 MLHD staff and 19 staff from Aboriginal Medical Services, and we built their knowledge, skills, confidence and their toolkit to enable them to promote healthy habits to parents and carers of young children. The reason why this is important is, as we know, the evidence is really strong. The first 2,000 days of a young person's life really set them up to promote a healthy future. One of the outcomes of recent Australian health surveys has demonstrated that over the course of our lives, we are prone to excessive weight gain at certain times. One of the surprising aspects of that was that the first time we're really prone to excessive weight gain is in the first 3 years of life. So our project is recognising the importance of the first 2,000 days, and we built the skills and confidence of health workers across our district to promote new framework of healthy habits and healthy lifestyle habits for families with young children, 0 to 6. So we trained 200 MLHD staff members and 19 Aboriginal Health Service staff members. We provided them with some updated toolkits. We built their confidence through case studies. We also developed an updated model of care for children above and below a healthy weight range. And together with fantastic support from Miriam Hellier and the health promotion team, we developed a series of 9 animations to promote healthy habits. So we're really honoured and we feel very privileged to have been nominated for this award. We are very thankful for the opportunity and it's wonderful to see the hard work of so many nominees in this organisation recognised. And we feel like it's actually a bit of sunshine after such a difficult sort of 18 months managing and working and living in this pandemic. So we wish all the nominees the very best and we congratulate them for their great work. Cheers.
The second finalist is the Alcohol and Drug Telehealth Service Pilot.
Hi, Erica Engelbrett here, Manager of Strategic Development, Drug and Alcohol and Early Intervention Programs. I'm speaking about the Excellence in Innovation Award that we were nominated for a collaboration between MLHD and St Vincent's Hospital. We are providing through St Vincent's Hospital access for drug and alcohol consumers of the MLHD to specialist addiction medicine consultations through a video consultation model. It's extremely exciting to be able to do this and quite an innovative process in the fact that video conferencing and other virtual technologies had not really been used widely for drug and alcohol consumers, using a hub and spoke type of model. So the clinicians on the ground work with consumers to assess, get them to an appointment with a consultant and then carry them through their journey and work with the consultant for their healthcare. The benefits are many. Consumers no longer have to wait an extended time for a consultation. This means that there is less adverse outcomes that could occur to people who are addicted to either prescribed or unprescribed opioids. Clinicians are having the opportunity to upskill and learn through this process with the addiction medicine specialists as well. It's cut down on things like travel time and made it much more accessible and equitable to all of our DNA consumers across the district. It's a privilege and quite a delight to be nominated for the award, and hopefully we win.
The third finalist is the Data Analytics Dashboard. The Data Analytics team developed a series of tailored dashboards to provide staff with easy, accessible data to help them make informed decisions. The dashboards are automated reporting tools that provide meaningful performance metrics in an interactive and visually aesthetic application, which makes the data easy to digest and to act upon. Recent dashboards have included operations performance, Aboriginal health, waitlist management, COVID dashboard, COVID vaccination, billing, and the winter strategy. And the winner is On Track for Life. Congratulations to the team. Thank you.
Congratulations to the On Track for Life team.
Well done everyone, and on to our next award this afternoon. We invite Gianna Manzini, Learning and Development Consultant from Aware Super, to join us in presenting the Diversity and Inclusion Award.
Hi, my name is Gianna Manzini. I'm one of the Learning and Development Consultants at Aware Super, and I'm also a very proud member of the Diversity and Inclusion Tribe. Now, what is the Diversity and Inclusion Tribe? Well, we're a group of employees from different areas of the organisation in different roles from different walks of life who have one thing in common, a passion for diversity and inclusion. The aim of our tribe is to work together to provide a diverse and inclusive workplace that reflects the needs of our organisation, our people, one that also mirrors the diversity of our members, employers and their communities. The tribe gives me and the rest of my tribe members an opportunity to really make a difference in ways that really matter to us, and it's something I'm really grateful to be a part of. Apologies I couldn't be there with you in person to celebrate the wonderful work that you do each day. It gives me great pleasure on behalf of Aware Super to announce to you virtually the winner of the Diversity and Inclusion Award. Now, this award is presented to an individual or team who demonstrate best practice or innovation to achieve better health outcomes for people from diverse backgrounds. The winner will also receive $1,500. Now to announce our finalists. First up, we have Lived Experience Facilitator Project. Congratulations on being one of our finalists. MLHD is committed to improving outcomes for people living with mental illness. The Lived Experience Project team is trialling a new approach that involves people with lived experience of mental illness delivering education to staff to improve their understanding, compassion, and connection with patients presenting with mental illness, and ultimately to improve the level of care that those patients receive. 10 participants from varied backgrounds and experiences were recruited to co-facilitate staff mental health training on the Safe Wards program. Those involved in delivering the training help shape the way that service is delivered, with the ultimate aim to decrease restrictive practices and to increase safety for all those who are involved with the service. And our next finalist is Virtual Social Work Service Wagga Wagga. Congratulations on being one of the finalists.
So my name's Sam Lloyd. I'm the Telehealth social worker with the Social Work Department at Wagga Base Hospital. In my role, I am the virtual social worker for the Murrumbidgee Local Health District, providing an acute inpatient social work service to all the outlying sites around Wagga Wagga Base Hospital and Griffith Base Hospital. I have been nominated for the diversity role, which is amazing. I think this role covers diversity in the multidisciplinary approach to patient care and having social work input available to patients in rural and remote areas where that service was not once available, really creates equal access to service right across the district. So I'm really excited to be nominated for this award.
Congratulations to both of our finalists for being finalists for the Diversity and Inclusion Award. Just reading the work that you've done is incredible, so you should all be proud. But there can only be one winner, and the winner of the Diversity and Inclusion Award and the $1,500 prize is Virtual Social Work Service Wagga Wagga. Congratulations.
Thank you, Gianna, and the Diversity and Inclusion Tribe at Aware Super. Sounds incredible. Congratulations to the Virtual Social Work Service Wagga Wagga.
Research and innovation are important in any organisation, and Murrumbidgee Local Health District value the development and advancement of knowledge. Congratulations to the finalists today, and please join Jenny Priest and the Agency of Clinical Innovation in saying a few words about this award.
Good evening. My name's Jenny Priest and I'm the Rural Health Network Manager at the Agency for Clinical Innovation. It gives me great pleasure on behalf of the Agency for Clinical Innovation to announce the winner of the Murrumbidgee LHD 2021 Research Award. But a bit about ACI. We are the lead agency for innovation in clinical care in New South Wales. We bring patients, carers, clinicians and managers together in the co-design and implementation of new ways of providing care in line with advances in technology, research, evidence and therapeutics. We do this through models of care, clinical guidelines, generating evidence and nurturing research, using the lived experiences of our patients and our communities, what actually matters to them, to drive change. The Research Award is presented in recognition of outstanding and innovative achievements in establishing ways of assisting clinicians and health decision makers in finding or using research effectively to positively impact practice. The winner will have an opportunity to visit ACI as part of a 2-day professional development package, with an itinerary tailored to the individual's area of interest and expertise. This year, there were 2 excellent submissions shortlisted for the Murrumbidgee LHD Research Award. One was nominated as an individual and the other nominated as a team, and both had absolute merit. The individual nomination was Dr. Madison Boot from Wagga Wagga.
Hi, my name is Madison Boot. I'm a new JMO at Wagga Wagga Base Hospital, and so far this year it's been an amazing experience to be part of the Murrumbidgee Local Health District, and I just want to thank everyone for all the doctors as well as all the allied health nursing staff and the community for being so welcoming. I have been nominated for the Research Award. It's been an absolute honour to be nominated for this award. I'm very new to research. I've only been involved in research for the past 18 months. And I think research is a really important part of medicine, and we have to couple the research with the clinical work. A couple of the research projects I have been involved in are quite interesting. So I've been involved in a few Australian first and world first cases. So the first one that I was involved in earlier this year was a rapidly progressing pulmonary empyema secondary to actinomycosis. I was able to present this at an international conference, and also as part of that teach people all about this really rare disease which actually occurred in a rural setting, and also how we can work with people to how we can work with both rural and tertiary centres to help to get the best for the patients involved in these life-threatening situations. The second one I was involved in with the team here in the Murrumbidgee Local Health District, and that looked at an iatrogenic cause of a duodenal diverticular during a nephrectomy. Again, I was able to present this at an international conference and was able to win best presentation in a London conference. It's been an honour to work with everybody in the Murrumbidgee Urology Department and General Surgery Department on this research. It is actually a world first case, and we're now currently writing up the best ways to prevent, recognise, prevent and manage this type of complication in surgery. I've also been involved in a few other side projects which have also, I think, will benefit both junior medical students coming through into junior doctors like myself, as well as really focusing on surgical oncology as well. A few of my other rural research projects that I've been a part of have been looking at the impacts of diabetic kidney disease in the rural area. This has been a pilot study which I've been performing over the past 18 months.
The team nomination was from the District Mental Health Drug and Alcohol team for their work in postnatal depression and anxiety.
Hi, my name's Carol Dehaan. I'm the clinical lead for perinatal infant mental health in MLHD. I recently led the translational research project titled Supporting Isolated New Mums in New South Wales using an e-health program for postnatal depression. The project was a partnership between Murrumbidgee Local Health District, Western New South Wales Health District, Charles Sturt University, Tresillian and the Parent Infant Research Institute. The project looked for the answers to what supports and what gets in the way of new mums who are experiencing postnatal depression accessing readily available evidence-based online treatment. The project was a vital way for us to hear the stories of new mums and their journey accessing help and using the online treatment. It's so important for postnatal depression to be treated as quickly as possible, as untreated postnatal depression can affect the new mum, her developing infant, the relationships around her, and it's also a huge cost to the Australian economy. The project was an invaluable way to hear about what clinicians needed to be able to support new mums accessing online treatments if required. So being nominated in the research category for these awards is really exciting for the team. It highlights the importance of research and how it can support our clinical practice and meet health needs. It's an opportunity to show how well the various partners, health, academic and industry can work together
for good outcomes. It's also an acknowledgement of the hard work of our research team, the steering committee, and the clinicians who are involved in the research project. And most of all, the value and the input of consumers with a lived experience to be able to share their valuable and humbling stories. The new mums shared that they wanted us to continue the conversation about their mental health needs and to continue to support them in accessing the right treatments. Being nominated for this award recognises the importance of the health needs of these new mums, and it also helps our team to continue the conversation.
So, the winner is Dr. Madison Boot from Wagga Wagga. Congratulations, Madison. We look forward to seeing you at the ACI. I'll be in contact with you soon to finalise the visit, which initially would have been this year, November, but potentially will now have to be early 2022 given the COVID situation. But congratulations.
Thank you, Jenny, for joining us today, and congratulations to Dr. Boot. I have been told the ACI team are very excited to welcome you to Sydney once we are safe to travel again.
I think we are all ready to travel, and I know my family are excited at the prospect of going anywhere at the moment. Today's next award is the Quality and Safety Award. Professor Mckenzie, University of New South Wales, has unfortunately been unable to join us today to present this award, and would like to pass on congratulations to all the finalists. The winner of the award today will receive $1,500 towards professional development.
Thank you very much, Michael, for your introduction. I'd like to acknowledge Professor Tara Mckenzie for the fantastic work she has done during the COVID-19 pandemic. So we're on to the award now, which is presented to an individual or a team who demonstrates commitment to continual improvement and an unyielding focus on quality and safety in caring for our patients, our residents, and our consumers. And the finalists for this category are the Young Emergency Department, Supporting Ageing in the Community, and Basic Life Support from the Murrumbidgee Clinical Education and Training Unit.
Hi, I'm Sam. I'm from the Young Health, where we're in the Emergency Department, where our team conducted a project on the presentations and mental health that come through, and we wanted to keep the KPIs down under 4 hours. So it was quite extensive gathering and getting all the information and doing the data collection, making sure that we correlate it back to the KPI hours. So our team, or my team, which was fantastic, we had a doctor on board, the emergency doctor, Dr. Chetton. We also had Kathleen down in patient flow, which was awesome, so we could organise transport and try and get that bit a bit quicker and see where our delays and that were. So with all the mental health presentations that we actually have, it was quite prominent that keeping them for more than 4 hours increased and heightened their aggression or their situation or their crisis at the time. So what we wanted to do was to lessen that down and try and build a better rapport with the mental health patients and try and give them some self-ownership of their presentation. So in the 12 months that we did it and we got all the data back, we have been consistently maintaining under 4 hours, which has been absolutely fantastic because before the project started, we were 10, 12 hours. So I'm very proud of that, and I'm very proud of the work that we've done and we continue to do in ED.
Hi, my name's Rebecca Keeley and I am the Project Officer coordinating the Supporting Ageing in the Community project here in the Murrumbidgee Local Health District. This project is a joint venture between the Murrumbidgee Local Health District and the Murrumbidgee Primary Health Network, and our aim is to try and support our most vulnerable ageing consumers in our community who still live at home and still are active within their communities, but who more frequently attend our acute facilities. We started the project as a big overview of what is ageing in our district and what are our most vulnerable consumers looking like. And so we did a big data look into what are our patients who go into hospital most frequently who are aged over 65 or over 45 if they identify as Aboriginal or Torres Strait Islander. with that data. We pulled it together and came up with an identification tool using the data of our district, so unique to our area, but also the data of what usually brings geriatric patients into our acute facilities. And with that, we developed an identification tool called the Murrumbidgee Aged Admission Risk Questionnaire, or the MARC. And that gives a patient a score from a low to a high score of a risk of being admitted to a facility. So that, in conjunction with some of the work that we already have within our systems in the district, like our new patient flow portal, we were able to identify patients who already are frequenting our facilities, and our goal is more than 10 admissions, or who are likely to frequent our facilities. Using that, we then developed a multidisciplinary team meeting and team approach to best comprehensively support these individuals. The patients consent to being a part of this, and we work very closely with our patients, and then our aged care team come together with our geriatricians, our nursing team, our allied health team, but also we reached out and we collaborate with other teams within this meeting. So we also work with our respiratory team, our other integrated care teams, palliative care, our GP network out in the district, and we try and really link that primary provider back, and even so far as to say Marathon Health for Care Coordination or other aged care service providers whose patients might be being discussed. As I mentioned, our patients consent, and so they're very involved in the process. Our approach aims to support these most vulnerable consumers that we have in our district, and we work really closely within our team, but also with the individual within the team. Communication is essential to what we do, and we make sure that all of the teams are communicating across the board to best link the patient with the right services at the right time. I guess I speak for the team when I say we're incredibly grateful for this nomination for the Quality and Safety Award. We believe the work that we're doing is making a really strong change in the lives of these patients in the district, and we're seeing that in our data, with up to 60% of our patients who've been discussed having not returned to our facilities since being run through our meeting and through our team. And we're really hoping that we can continue to do this strong work to make the lives of our elderly consumers in the district just that little bit better and help them age at home. Thank you.
Hi everyone, my name's Kim Howard. I'm the manager of the Clinical Education and Training Unit here in Murrumbidgee Local Health District. Today I'm talking you through our quality project for the Quality and Safety Excellence Award through Murrumbidgee, and our project is the Basic Life Support Project through C2. So what our project is it's improvement in the quality of basic life support assessment that we give to our clinical frontline staff, and there's a pilot program between Wagga and Griffith-based hospital. So we have 1,650 licences that we've allocated to the three craft groups, being medical, nursing, midwifery and allied health. What the program does is you can walk up to any of the cards that are located on the wards, and you can just enter in your staff link number and complete your basic life support assessment without anybody coming to do the assessment for you. It's an automated process. So what we find is that you get real-time feedback from the computerised system, and it will tell you about your hand placement, your hand depth, also the rate of compression and ventilation, and AED placement as well. What we're finding is everyone who's using the program within the first 7 to 10 seconds, based on that automatic feedback, they are getting the BLS components correct within the first 7 to 10 seconds. And that's improving the compression, the depth and release, the rate, ventilation and AED, as I said. So the reason that we find this really effective is it is an essential skill that we have for our staff, and we're finding that it will have some positive patient outcomes in the event of a sudden cardiac arrest. So thank you very much for the nomination, and we look forward to continuing with the program.
And apologies for that small technical glitch at the beginning of this category. I'm just going to read out the finalists for you all again now. The first is the Young Emergency Department. The second, Supporting Ageing in the Community Project, and as we've just heard, Basic Life Support with the Murrumbidgee Clinical and Education Training Unit. And the winner for today's Safety and Quality Award is Supporting Ageing in the Community Project. My heartfelt congratulations to all of the team that we've just heard for this wonderful work with our elderly residents and citizens of our region.
Thank you, Jill. Recognising our people is why we have all tuned in today. The next award highlights the great qualities of our people and our culture. The Our People, Our Future Award is sponsored by Lease Plus. Over to you, Atuns.
Hello, my name is Atuns Teze, Managing Director and CEO of the Lease Plus Group. I'm joined by Simon Ellis from Salary Packaging Plus.
Hi, it's good to be with you.
And Lee Penberthy from Lease Plus.
Hello, and thank you for the opportunity.
Many of you would recognise Salary Packaging Plus as your newly appointed salary packaging provider, along with Lease Plus being the name behind novated leasing services in your district. I want to thank all the Murrumbidgee Local Health District staff who have recently responded to our surveys and commented on the exceptional services provided by both Salary Packaging Plus and Lease Plus. I want to also extend my thanks for the opportunity to be involved with the 2021 Excellence Awards. It's unfortunate that we couldn't be there in person to celebrate all the wonderful work that you undertake each day, but we'll do our best to deliver this virtually.
Thank you, Atunch. The Our People, Our Future Award is presented in recognition of an individual or a team who showcase Murrumbidgee local health districts as the best place to work, to lead, practice, volunteer, teach, learn and grow. The winner will receive $1,500 towards their professional development. It gives us great pleasure on behalf of Lease Plus and Salary Packaging Plus to announce the finalists of Our People, Our Future Award. Over to you, Simon.
Thanks, Lee. The finalists are as follows. Finalist 1 is the Borough Nursing Team. The Borough Nursing Team implemented weekly training exercises to build skills, knowledge and resilience. The sessions have been a great success and have ultimately resulted in higher quality care and better outcomes for patients who present to the Borough Emergency Department. Finalist 2 is Narelle Mckenzie, Community Care Clinical Operations Manager.
Hi, I'm Narelle Mckenzie. I manage the Community Care Nursing Service, the respiratory stream and the TV services. I also oversee the COVID static clinics, and I believe that I'm only able to do this through the support and dedication of my nurse unit managers and all my community care staff, which includes my COVID static clinic staff, nursing and administration. I'd like to thank them for nominating me for this award.
Finalist number 3 is Rebecca Keeley, Project Officer supporting ageing in the community.
Hi, my name is Rebecca Keeley. I am a qualified speech pathologist and currently working as a project officer with the aged care team here in the Murrumbidgee Local Health District. I was raised in a small town here in the Murrumbidgee called Cullyamberley, which is a population of about 650 people, an hour from Griffith. And I was brought up there on a farm when I was very young before relocating to Darwin in the Northern Territory. Obviously, I loved the district and came back after working in the Territory for some time, and I've had a range of roles in the period that I've been here, including as a senior speech pathologist at Wagga Base Hospital, working with the cancer and oncology team, and then moving on to establish the speech pathology department at Griffith Base, which was a fantastic challenge and a really exciting project to be a part of, establishing a service in a hospital that didn't previously have a service. And then since then I've recently moved into a very exciting and innovative role with the Supporting Ageing in the Community project, working with the Murrumbidgee Local Health District and the Primary Health Network to better support our ageing consumers in the district. The work of which the team is incredible and I'm very proud to be a part of. I love working in the MLHD, I guess because of the uniqueness of the challenges that we see down here in rural health, and I continue to be incredibly passionate about rural health service provision and making sure that our consumers can access equitable services that maybe they can't get being in such a remote or rural location. I think there's lots of opportunities for innovation, and the relationships you build with your colleagues and patients is something that I'm incredibly grateful to be a part of, and I'm feeling very humbled and very blessed to have been nominated from this award by the aged care team, so a big thanks to them. I guess some other things I love doing. I run a mentoring program for young allied health professionals who work in rural and remote areas to better peer support one another, being out in places where maybe we're not so close to our friends and family. And I also have a little passion volunteer side project running a gentle exercise class here in Colliamberley, the community I'm from, for our older consumers to keep them healthy and active in the community, which I do in a volunteer capacity, but probably get a lot more out of it for myself than they do. But sadly, with the COVID response, we're currently on hold, but I'm sure that the ladies are very excited to get back into the hall, and I'm very excited to work with them. So again, thank you so much for this nomination, and I hope to continue working with everyone here in the district as we move forward through the COVID response and in the other works that we're doing. Thank you so much.
Good luck, everyone. And the winner is Borough Nursing Team. Congratulations to everyone within the team. Thank you.
Thank you, Atunt, Simon and Lee, for announcing the winner today, and love the improvised drum roll at the end. Well done to the Borough Nursing Team, and congratulations to all those involved in the emergency department.
Michael, I believe the next award for resilience is sponsored by the Pegasus Health Group today.
Yes, Millie, it sure is. Pegasus Health Group has been a contractor for New South Wales Health and Murrumbidgee Local Health District for about 15 years now, and we supply pressure injury prevention products as well as a range of other products throughout the Murrumbidgee Local Health District. We also have another business of Hospital at Home, which we supply to services and products to allied health and palliative care, including end-of-life equipment for people in the community. So we're very proud of the work we do, and we enjoy working very much with Murrumbidgee Local Health District. And we certainly have had to be very resilient this year in the face of adversity and the challenges the district has encountered. Today's award symbolises this, and the lucky winner will receive $1,500 towards their professional development. The finalists today are Virtual Dietetics. The virtual dietetic pilot model provides equitable access to nutrition services, increased involvement of patients and their families in decision making and nutritional therapy support for New South Wales staff. The pilot establishment enabled the team to combine their strengths and support networks to collaborate and provide services for broader community benefit. Geriatric Evaluation Management Outreach Team, the Public Health Unit Team.
Hi, I'm Matt Thompson. I'm one of the geriatricians here at Wagga Base Hospital, and I'm one of the people who takes part in the telemedicine service for the southwest region of MLHD. Now, we kind of originally started this kind of service almost 12 months ago now, actually, once when kind of the first wave of all the COVID restrictions happened. Up until that point, I was driving to and from Deniliquin mainly, which is sort of about 2.5 hours southwest of Wagga, and seeing patients remotely there, patients that were referred to our service from their GPs locally. And really was just trying to provide a bit of a service to these people living in the remote areas to the southwest of Wagga, who have very limited access to specialist input. We were mainly sort of having patients referred by their GPs who needed comprehensive geriatric assessments, and up until this point, up until we provided this service, they would have to travel to Melbourne and Victoria to see these specialists there. Now, when the first round of all the COVID restrictions happened, there were restrictions to travel and border closures, and we were advised not to travel to the southwest region any further. And we really had two options. We could either withdraw our service for a period of time or try and provide a new way of delivering that service. Now, up until that point, we'd seen the odd patient via telemedicine using the laptops, really just to see patients very quickly when sort of time was of the essence. And we kind of thought maybe we could build on that service and try and see a few more patients via that route. And it's actually worked incredibly well. We had our major reservations before starting the service virtually. We thought, a lot of our patients might struggle because of problems with hearing and vision, and also we kind of thought they probably wouldn't be all that comfortable using the technology. But actually, we found that the service was way better and went way smoother than we expected it to. A lot of our patients who we expected to struggle to see via that medium virtually actually took to it really well, and there've been loads of benefits in terms of sort of lowering the amount of time that I waste travelling to and from kind of Deniliquin and the surrounding areas to see patients. It's way more convenient for the patients who can just travel to their local GP practice. It's allowed us to have relatives present in the consultation who might even be in different states at the same time. And kind of the problems that we've had to overcome, we've overcome pretty easily using some technology. We bought a very loud Bluetooth speaker, which has seemed to have worked really well at kind of helping our patients who are hard of hearing be more part of the interaction. And on the whole, the kind of the services has been a real success. And actually, kind of having the driver of COVID to kind of make us really focus on delivering this virtual service has been a fantastic thing. And actually, when all the restrictions were lifted 6 months or so ago, we actually carried on doing the service the way we have now and trying to sort of provide the majority of our service virtually because it's worked so well. So actually, kind of out of COVID, this has been one of the great things that's come out of it. In terms of kind of being nominated for the award, it's great to be to sort of have the work you do recognised. And certainly, particularly for Sarah Rose, our CNC, and for Karen Bishop, our admin, who have put an awful lot of work behind the scenes as well in trying to sort of make this a success and help this sort of run well. It's really great for them as well to have a bit of recognition of sort of the really hard work that they've been putting in.
The public health nomination, well, the public health nomination for resilience is a reflection on the public health's work over the last 18 months in COVID. The public health unit and the health promotion team have combined to do a fantastic response in COVID, and some of that activity includes the contact tracing, but prior to having cases, it's also involved some regulation work, making sure that businesses know their COVID safety plans, looking after working with businesses to get together plans for what to do if they have COVID in our community, as well as running through some scenarios with our health partners and our other partners in business so that we can be as prepared as possible for when we get COVID cases. And then throughout the year, the team has had to step up and do activities as outbreaks have occurred. And that's largely what the nomination has been for. So the public health unit team and the health promotion team have all put their hand up to do activities that's been outside their normal duties in an endeavour to provide the public health response that's been required. So some of that has been risk communication with the public and letting them know what to do and how to stay safe. It's been following up vulnerable people, so people with COVID, when we interview them, and the compassion that the team has shown those people has been brilliant. They're very vulnerable, many of them are frightened, and many of our interviews have been with people outside our district, so the team has stepped up to support the Sydney outbreak and other outbreaks that have occurred over the last 18 months. And so we've got people who are doing contact tracing who normally would not do that. We've got every single staff member has put their hand up to do that or support the response through data entry or any other activities. The public health unit hours have increased enormously. We used to we always run a 24-hour service, but pre-COVID, it's just been on call and very rarely did we get calls. Now we run our business from 8 a.m. in the morning to 10 o'clock at night with shifts throughout. And so the staffs are working long hours and 7 days a week. And so it's been an enormous pressure on people, and we are trying to look after them, but people have just put their hand up to work. So it's been an incredible response by the team, and that's what this nomination has been about, just to recognise the extraordinary work of the whole team in trying to keep the community safe and supporting the district and supporting the state for their COVID response. And it's lovely and humbling that we have been selected as a nomination for an award. I think the team is brilliant, and I'm very proud of them. And I think that this is just perfect recognition for them for the efforts that they have put in, and we can see that the effort's going to need to continue for some time. So it's very lovely to have recognition for the work that people are doing.
Drum roll, please, Michael.
On the spot. And the winner is Geriatric Evaluation Management Outreach Team. Congratulations to you all, and well done on improving the health and well-being of our communities.
Thank you, Michael. Wow, today we have seen and heard about some of the many diverse projects we have throughout the district. Joining us now is Mayor Rick Furman from the Temora Shire Council to tell us a little more about the next award today and announce the winner of the Volunteer Award.
Good afternoon. My name's Rick Furman, the Mayor of Temora Shire, and we're very, very proud to be a sponsor of today's Murrumbidgee Local Health District Excellence Awards. And Temora Shire Council are very pleased to be among those generous sponsors at this year's MLHD Awards. And Temora Shire strongly believes in supporting our local and regional communities wherever possible. And we particularly enjoy paying tribute to those who give of their time so generously to help others. And volunteers are a very special part of the very backbone of our rural communities, especially in healthcare. And this award applauds our unsung heroes, acknowledging those who are passionate about putting the needs of others first. We congratulate all award nominees, and in particular our finalists today. As they say, there's nothing stronger than the heart of a volunteer. Today's winner will receive $1,500, and I'm sure that will be spent very wisely. The finalists in this year's category of Volunteer of the Year are Mrs. Laurene Liebenberg, the Chairman of the Deniliquin LHAC.
Hi, my name is Laurene Liebenberg, and I'm the Chair of the Deniliquin Local Health Advisory Committee. I'm extremely honoured to be nominated for this award, given the large number of volunteers we have across the Murrumbidgee who all do amazing things to contribute to the health outcomes in our community. As the chair of Deniliquin Local Health Advisory Committee, as a volunteer in the organisation, I lead a group of wonderful, committed people, and what we do is to really focus on the health needs of our community in terms of advocacy, making sure that our community has got all the information they need to be able to access the services offered by Murrumbidgee, and also importantly to support our local health service. In the past year, one of the biggest things that I guess I've done as the chair was to reactivate our Facebook page, and we did that to make sure that we had a platform in which to inform people of provide accurate information about the services that we do have in our town, how to access those services, to introduce them to the staff, who are part of those programs. But the other thing that happened is that COVID happened, and we recognised that people needed to have the information to be able to continue to access medical appointments, often which needed to be outside of Deniliquin and sometimes across the border. And so what we started is to provide information about cross-border access, about border restrictions, rules, permits needed to ensure that our community had that information. And I truly believe that the information that we have provided, which now is not only followed by Deniliquin, this Facebook page has grown significantly. We have over 3,000 followers across the entire border region. But what I do believe the importance of this project has been and continues to be is that it reduces the anxiety for people. It gives them the information they need to be able to make good choices. And I truly believe that having this information has contributed greatly to the safety of our communities across the border regions during the COVID pandemic. Thank you once again for the nomination, and have a wonderful evening.
Our next finalist is Mrs. Frances Day, OAM, the Chairman of Lockhart LHAC.
My name is Frances Day, or Fran. Being shortlisted for this award makes the Lockhart LHAC team and myself so very proud. I feel humbled, honoured and thrilled to be nominated for the MLHD Excellence Award in the category of volunteer. I am passionate about empowering the residents of Murrumbidgee Local Health District, MLHD, in health and wellbeing. I am involved in the following committees: Chair of the Lockhart Local Health Advisory Committee, LHAC, Committee Member of COAG for improving access to primary care in rural and remote areas, Border LHAC Chair, Committee, Consumer Representative of the Clinical Governance Committee for MLHD, Deputy Co-Facilitator and Consumer Representative for the Leadership Group for New South Wales Ministry of Health, Elevating the Human Experience, Enhancing Patient and Staff Experience and Delivering Improved Quality and Safety Outcomes. In 2020, Lockhart LHAC was successful through the Murrumbidgee Primary Health Network to receive the Empowering Our Communities grant to engage, educate and empower the Lockhart Shire with community, educational, mental health, wellbeing, flyers and promotional material. The flyers were focused on resilience and capacity to overcome stresses during drought during the COVID-19 crisis. And the project was very important for the community and MLHD as it gave tips and strategies to maintain good mental health, raise awareness, promote positive health and wellbeing, and all information sourced from New South Wales Health and Government departments. The project has raised awareness through mental health literacy to the people of Lockhart Shire community, and the community is more aware of the services provided, connecting them to the right people to help them to give them mental and emotional support and in the time of need. And I feel so very blessed to have had so many great opportunities to give back to the community. Thanking you so very much.
And our final finalist is Mrs. Jeanette Locke, Physical Activity Leader.
My name's Jan Locke and I'm a general exercise leader and Tai Chi leader. I was nominated for the Excellence Award for Volunteers and absolutely shocked. There's many volunteers out there and they put hours and hours of work in, and I'm just so honoured to be nominated. Thank you. I've been with MLHD for 6 years now and I do gentle exercise. I've had hundreds of ladies come through my class and they've all enjoyed just coming and improving, mixing with the other ladies. We're so proud of what we have achieved over those years, and we performed in parks and the festival, and they did so much of being together. I'd like to thank Carly, Adele, my coordinator Alex Walker and Megan Matley. They're always there to support me. Any little thing that I do, they're there and it's great. I'd like to thank you. Thanks for nominating me. This is just such an honour and a privilege just to be accepted. And you know, we volunteers, we just do from the heart and get as much back. It's hard to explain, but everybody should volunteer and just give and get so much out of it. It's wonderful.
Well done to all nominees, and particularly well done to our finalists. And it gives me great pleasure to announce the winner of this year's Volunteer of the Year Award. And the winner is Mrs. Jeanette Locke, Physical Activity Leader. Congratulations, Jeanette. Well done, and we thank you so much for your service.
Thanks, Jan, for being so passionate about the health and well-being of your community. Well, Millie, we're down to the last 3 awards of the day.
Yes, Michael, I am anxiously awaiting the announcement of the Chief Executive Award, the Board Chair Award, and the Executive Director of Nursing and Midwifery Award. Do you think I'm in the running?
Everyone has an opportunity to nominate and participate, Millie. And the Board Chair Award and the CE Award are selected from all the nominations received.
Let's cross now to the Executive Director of Nursing and Midwifery Award presentation for excellence. Thanks, Julianne.
My name is Julianne Clift and I'm the Acting Executive Director of Nursing and Midwifery for the Murrumbidgee Local Health District. I've had a wonderful role this afternoon to announce the winner of the 2001 Executive Director Nursing and Midwifery Leadership Award. This award is presented by the Executive Director of Nursing and Midwifery to a nurse or midwife who has demonstrated excellence in leadership. This award is one that is not open for nomination, but rather about recognising an outstanding nurse or midwife leader in the Murrumbidgee Local Health District. It may be someone who is a quiet achiever and goes about their daily, day-to-day business without fuss, or it may be someone whose actions have made a significant contribution to nursing and midwifery, or even an outstanding clinician. A nurse leader is someone who exemplifies what it is to be a professional nurse by upholding the professional standards, motivating and providing support to others, and always being focused on the outcomes for our patients and consumers. There were many potential recipients across Murrumbidgee who have demonstrated what it is to be an outstanding and excellent nurse or midwife. The winner will receive $1,500 towards their professional development. And I'd like to congratulate all the finalists in this category who go above and beyond each day in their respective teams. The nominations are Naomi Slater from Young Health Service, Sinta Talili Pelasasa from Narandra Health Service, Bailey Pursehouse from Young Health Service, Helen Johnson from Young Health Service, and Shelley Waldron from Harden Health Service. And without further ado, the winner is Cheryl Waldron from Harden Health Service. Congratulations and thank you.
Congratulations, Cheryl, and I thank you and the hundreds of nurses and midwives across the district that are tirelessly working around the clock to keep our community safe. So maybe next time, Millie.
Thank you, Michael. Without further ado, I have great pleasure in welcoming back Miss Jill Ludford, Chief Executive of the Murrumbidgee Local Health District, to announce the winner of the Chief Executive Choice Award.
Thank you very much, Millie. And I just would like to extend my thanks and appreciation to our two hosts today. Millie, you've got to be in the running for a future award. And Michael, I really appreciate your sponsorship and helping us out today. Thank you. So the Chief Executive Award is selected based on nominees really displaying fantastic leadership and also the core values of New South Wales Health, new and innovative ways of working with consumers and our communities, and the ability to inspire and motivate. And it was easy for me to select the winner today. The recipient is above and beyond all of those things and more. They epitomise the value of collaboration through their advocacy for their community and the health needs of the district as a whole. They're very honest and open with their communications and have led to the development of community-focused promotional material, which is improving health outcomes for their region. The best thing about the person I've selected is they're authentic, humble, respectful, and always diplomatic in their interactions, and show compassion every day. People have commented that they feel listened to and heard in their conversations, and I always feel the same. They have participated in the 2021 staff orientation video, The Consumer Voice. I think I'm giving something away now. They are a passionate advocate for their local health advisory committee and are a consumer representative on the Murrumbidgee District Quality Safety Council and the Murrumbidgee Breast Screen Committee. They have led a series of promotional campaigns to raise awareness in the community, including immunisation at schools, news on health promotions and activity in hospitals, men's health, pit stop at the Spirit of the Land Festival, to name just a few. My winner is humble and unassuming, and she derives genuine joy from the work that she undertakes for her community and for the Murrumbidgee Local Health District. So without further ado, the winner of the Chief Executive Award is Fran Day, OAM. Congratulations, Fran. I'm picturing you standing here in front of me. and I cannot thank you enough for all that you do. Every day you show compassion and care for people not only in our district but for your whole community. Thank you.
Thank you, Jill, and congratulations, Fran. You have so many great achievements, and this is another one you can be very proud of. I'd now like to call on Board Chair Dr. Thomas Douch to announce the winner of the Board Chair's Choice Award.
Hi, my name's Tom Douch and I'm the new Chair of the Murrumbidgee Local Health District Board, and I welcome you to this award presentation. It's my job today to award the prize for the 2021 Board Chairs Award. At the start, I'd like to say it's been a pretty tough couple of years, what with drought, bushfires, and of course now the COVID-19 pandemic. I've been very proud of how people have stepped up into new roles, covered people who have been unable to work normally, and generally tried to look after our community as we struggled through these difficult times where resources always seem short. And I'm humbled by those people who have made that extra effort to undertake activities, initiatives, projects that seek to achieve excellence in the quality of care that we provide to our communities. In looking to award the Board Chairs Award, I've been seeking something that might be an area that has high demand, maybe an area that is difficult for people to access because we have fewer resources than we would like, and perhaps something that we can circulate across the entire Murrumbidgee area, indeed throughout rural New South Wales, and maybe even beyond to rural Australia. It's been a tough decision. There are many great initiatives and projects that I've had to look through. But I'm pleased to announce that the 2021 Chairs Award goes to the Drug and Alcohol Telehealth Pilot Project. This is a great project, and I really congratulate those people who have been involved in that, and I congratulate you on the award. But for those of you who are more widely involved in the search for excellence, as represented by the projects we've seen here tonight, I'd like to say thank you. Well done. It's a great effort that you've undertaken, and it's a great thing for Murrumbidgee that you're willing to go the extra mile to try and search and seek excellence. Thank you for tuning in. Thank you for attending. Best wishes for the future. Stay safe. And again, congratulations to all those who have won an award. Thank you.
Congratulations, and congratulations everyone. Can we have a huge round of applause for all the nominees and award winners? Come on, you can all do better than that.
Hey. Well, Millie, I believe this concludes the awards presentation this afternoon. MLHD would like to acknowledge and thank all the winners today who will be invited to the annual public meeting later in 2021. The judging panel who graciously volunteer their time, the nominators for making the judges' decisions so hard each year, and all of you out there watching today, thank you for joining in our celebration.
And a huge thank you to all of our award sponsors who all passed on their best wishes and congratulations and apologies for not being able to join us in person. Lease Plus, Pegasus Health Group and Pegasus Hospital at Home, the University of New South Wales, Medax Healthcare, Three Rivers Department of Rural Health, Riverina Rural Training Hub, Agency for Clinical Innovation,
Murrumbidgee Primary Health Network, Aware Super, Temora Shire Council, Griffith City Council, and Damasa Proprietary Limited. Thanks, Millie, for inviting me here today. It has been an absolute pleasure.
And thank you, Michael and the Pegasus Group, for their sponsorship of the awards and for recognising and acknowledging the exceptional work our teams do each and every day. See you soon, everyone. Thank you for tuning in and supporting your colleagues. Look forward to seeing you soon.
Again soon.
And have a great afternoon.
Bye.